I want to go over with you this picture right here, which is going over NG2 feeding and how we give NG2 feeding. So as you can see in this photo, you can see the feeding inside of the tubing, and then also you can see the patient's as well, along with it hooked up through the patient's nose. And so this is really important to understand when we're giving this type of feeding. So first and foremost, why are we giving the feeding through the patient's nostril, right, through their nose versus them being able to eat through their mouth? So one of the reasons why is a patient for whatever reason cannot swallow, and so now we have to pretty much create another method for them to eat, and this is going to be a more of a longer term solution versus as opposed if, for example, if they were on like fluids and they were getting D5NS or something like that. This is a longer term solution for patients that cannot swallow, have some type of bowel obstruction, that type of thing. And so you're going to typically use a 60 cc syringe, which is what the syringe is that it's in this picture. And when you're giving this feeding, one of the things that you have to check, if this is a continuous feeding, then you have to check something called residuals, and it's to make sure the patient is actually absorbing the feeding before you push any type of medications or anything like that. So this, however, is by gravity. So they're literally putting the feeding in and allowing it to go by gravity. And typically it's going to be administered every 4 to 6 hours with flushes. If you found this helpful, go ahead and hit the follow button and check out the link in our bio for some of the resources we offer that will help you to better understand nursing content.